The situation surrounding the spread of the deadly Candida auris fungus is becoming increasingly dire, with the Centers for Disease Control and Prevention, CDC, failing to adequately address the growing crisis. Despite being labeled an urgent threat by the CDC, the agency's response has been insufficient, and the fungus continues to claim the lives of hospital patients at an alarming rate. In fact, between 30% and 60% of those who contract this drug-resistant fungus die, which is significantly higher than the mortality rate for COVID-19. This represents a critical failure of the CDC to perform its core function, and Health and Human Services Secretary Robert F. Kennedy Jr. must urgently reform the CDC to prevent further harm. Since the first identified case in 2016, Candida auris has spread across 29 states, including New York, and its prevalence continues to rise. According to recent reports, in 2024 alone, there were over 4,500 confirmed cases, 9 times the number seen in the measles outbreak, which garnered much more public attention. The CDC, despite acknowledging the threat, has been largely ineffective in curbing the fungus's spread, revealing significant deficiencies in both leadership and protocol. This highlights a dire need for reform within the CDC to better address emerging public health threats. The agency's failures are not just limited to its sluggish response time, but extend to its unwillingness to adopt newer, more effective technologies that could help curb the spread of this deadly fungus. Rather than confronting the issue head-on, the CDC has focused on unnecessary distractions, such as policing language in healthcare settings. In 2021, while Candida auris cases surged by 500%, the CDC spent its time scolding healthcare workers for using terms like mother and father and focusing on politically correct terminology. This misguided focus on woke issues is a massive diversion from the agency's real mission, stopping the spread of life-threatening diseases. Moreover, the CDC has failed to provide the transparency necessary to protect the public. It has refused to disclose which hospitals are battling C. auris outbreaks, instead protecting the reputations of these institutions at the cost of public health. For instance, when the fungus invaded a neonatal intensive care unit in Las Vegas in 2022, the CDC concealed the hospital's identity for an entire year, only revealing the outbreak in a vague report that referred to it as Hospital A. This lack of transparency leaves patients unaware of the risks they might face when seeking care at certain hospitals. If a hospital is dealing with an outbreak of a deadly fungus, patients deserve to know where the risks lie. The CDC's outdated infection control practices also exacerbate the crisis. Its guidelines for hospital infection control remain stuck in the past, recommending ineffective methods, such as using outdated detergents and laundering mop heads. In contrast, newer, proven technologies that could help decontaminate hospital rooms, such as dry hydrogen peroxide emitted through HVAC systems or far UV light, are largely ignored by the agency. These technologies have been shown to significantly reduce fungal contamination and could be key to controlling the spread of C. auris. However, the CDC remains suspicious of solutions from the for-profit sector, dismissing advancements that could save lives. This failure is not isolated to Candida auris. The CDC's inadequate response to the COVID-19 pandemic revealed similar shortcomings. Instead of implementing available technologies to ensure schools could reopen safely, the CDC issued confusing and ineffective guidance, such as opening windows and maintaining arbitrary 6-foot distance requirements. This lack of practical, science-backed advice severely hindered efforts to protect students and staff from the virus. The public deserves a CDC that is equipped to provide up-to-date, scientifically rigorous guidance on infectious diseases. Robert F. Kennedy Jr. must prioritize the overhaul of this agency. The CDC's resources should be directed away from unnecessary projects and refocused on fighting deadly diseases like Candida auris. The agency's failure to adapt to modern technological advancements and its continued reliance on outdated methods put the lives of countless Americans at risk. The time for reform is now, and if the CDC continues to operate as it has, it could cost many more lives.